Welcome everyone. I'm Cynthia Resendez, Marketing Manager at Avenue 360. Today we're joined by some of our mental health providers who see patients at our Houston clinics or through a virtual visit. We continue to take enhanced safety measures inside our clinics to protect our patients from COVID. I'd like everyone to go around and please introduce yourself briefly before we discuss some of the behavioral health challenges we face in Houston and how we're helping the communities we serve.
Thank you, Cynthia. My name is Sandra Smith. I'm the Recovery Support Counselor at Avenue 360.
Thanks so much for having me. My name is Ebony Scott. I'm the Licensed Professional Counselor at our Southwest location.
Hi, I'm Dana Hatter. I am the Licensed Professional Counselor located at our Griggs, our Humble, and our Spring locations. Thanks for having us.
Hi. Thanks for having us do this. My name is Cynthia, and I'm a licensed professional counselor at the Heights location.
Thank you, everyone. Let's get started. So my first question goes to Dana. What have you seen as the impact of the coronavirus on behavioral health?
What I've seen as an impact with coronavirus on behavioral health as an impact is increase in anxiety and depression, symptoms with decrease in access to social supports due to the pandemic. And so in other words, we have a lot of people who have that increase of anxiety and depression, and their social supports that were outside of their homes, they're no longer able to get to because of the pandemic. One, because of the fear of getting it, or two, just being scared to go out. And in a lot of places have shut down their hours. Just like with us providers, we are doing more telehealth instead of doing in-clinic in-clinic sessions. And so that means that they can't go to their normal group sessions or their day programs. And even like for myself, I have college students who can no longer go to school, but at the same time, they have to be here in Houston and they might not even be from this area or this city. So then they're away from their families and they're in an apartment or in a dorm all by themselves, but they can't go into the actual school and have in-session classes. So that's an increase with that I see across board.
Thank you. Ebony, how does someone know they're experiencing anxiety or depression, and what are the symptoms?
So feeling down or sad or upset is normal. Fear and worry can happen to anyone from time to time, but there's cause for concern when these feelings last for several weeks or longer, or they interfere with their daily life. So decreased energy, fatigue, difficulty concentrating or recalling, stomach problems without clear cause, difficulty sleeping, irritability or restlessness are symptoms of both depression and anxiety, and they can affect our ability to live and interact daily. Physical symptoms of anxiety also include muscle tension, racing heart rate, grinding your teeth, problems falling asleep or having a restful, satisfying sleep, or feeling on edge, difficulty managing worry or fear or panic, and they're more likely to affect the way that we respond to other people. Physical symptoms of depression may include feeling sluggish or sleeping too much, waking up earlier than you like, or difficulty making decisions, or pain without clear cause, changes in appetite or weight. Emotional symptoms include no longer finding pleasure in activities or hobbies, or persistent feelings of emptiness, hopelessness, pessimism, even anger or guilt, and ultimately feelings of worthlessness or helplessness, or thoughts of death or even suicide attempts. Let's erase the stigma and don't wait to get help. Oftentimes, people dismiss these symptoms until it's too late. Anxiety affects 40 million adults in the United States every year, and major depressive disorder affects 16.1 million adults. We need people to know that they are not alone and that we are here to help.
Thank you. Dana, this actually leads me to another question. Due to COVID-19, many children are now attending school virtually. What signs should a parent look for if they're concerned that their child might be suffering from depression?
So, and kind of piggybacking off of what Ebony says with all the depression signs, but it more intense with the children who are doing the virtual learning. Parents need to understand that depression is more than just a feeling of feeling sad and having a bad day. It's a child who seems to be stuck in a negative mood. feelings of hopelessness, not able to be enjoying anything, and may have not being able to bounce back on a daily basis. So when it comes to depression and virtual learning, you might have a child who used to be a straight A student and their grades are dropping. So parents really need to understand and watch their kids' grades and speak with the teachers. And also some of those is changes in weight when you're not seeing your children eat because they don't even want to eat lunch. They're not taking lunch to school anymore. Their sluggishness, so they're always trying to be sleepy and don't want to get online to do their discussions. And then a lot of children, I mean, we experience bullying in school, but we also have bullying when it comes to virtual learning. And I think parents need to watch that as well as the teachers, because we might have some teachers who are parents as well. So they might need to look at whether or not a child is afraid to get on virtually because they're afraid other kids are going to, and sometimes even with your computer system, it might not be as good as it's someone else's. And so other kids might laugh at you or tease you about that. The shifts in their sleep patterns, loss of interest in activities that they once enjoyed, unusual sadness, irritability, or persisting even when circumstances have changed. Those are some of the symptoms that you can watch for, but mainly watch their grades and their activity level.
Thank you. Cynthia, there have been many people experiencing financial hardship, instantly becoming caregivers, and many parents who are now managing work and teaching their kids, which can ultimately lead to stress. What are some healthy ways to cope with stress?
When I talk with patients here, one of the things I often hear when I ask people how they're managing their stress is, well, I'm watching a lot of television. And there's nothing wrong with that, but when it gets to be a problem when that's our only way of coping with stress, or sometimes we're doing things like sleeping more, eating more, drinking more alcohol, things like that. Some of the healthier ways to deal with stress, first of all, having our routines as normal as we can, having a daily routine, and especially because schedules are so interrupted right now, people often don't think about the importance of having a daily routine because that gives us a sense of purpose. That's a reason to get up in the mornings. And doing things like keeping our bedtimes at the same time, having that on a set schedule, being careful of things that we do before we go to bed, that we've turned off our devices. We're not having alcohol or caffeine or nicotine before going to bed because that can disrupt our sleep. And then in the mornings, having a routine that will set a positive note to the day is after we've gotten ready in the mornings, doing things like maybe taking a few minutes to write down some things that you're grateful for. There's so many difficult things going on right now. I think that can become people's focus. It's easy to fall into that trap. Keeping a gratitude journal, and there's lots about that online, that's a way to help us remember that there are also good things happening right now. Having maybe spending some time journaling, spending some time meditating, that can be really helpful during this time. Also, the bedtime at night, looking at what we're doing before that and then looking at what we're doing in the mornings when we get up. And when we go to bed at night, also making a plan for what are some things I need to do tomorrow and write that down, because sometimes that can keep us awake at night. And even taking some time during the day to breathe. And I know some folks would say, well, I think I'm already doing that. But we may be doing breathing that leads to stress or increases our stress. And there's a very simple technique that people can do to help with that, which can help reduce stress. And it's breathing in to the count of 4, holding that breath to the count of 4, breathing out to the count of 4, and then holding it out to the count of 4. So doing that, it's called a box breath. Doing that for several repetitions can help us calm down. So something as simple as that can help.
Thank you. Sandra, this actually has been a topic of discussion, substance use during COVID-19. How is Avenue 360 supporting those who are experiencing a substance use disorder?
Thank you for asking, Cynthia, and thank you to my colleagues for those fantastic observations. we know that during times of global uncertainty, that substance use is often a coping skill for the masses, right? And we've seen this observed through the fact that our opioid overdose rates are rising. Alcohol use is on an increase. And so we know that societally, the use of substances is a coping mechanism. However, as Cynthia was mentioning, it's a coping mechanism that can develop into a substance use disorder. And it's important to know that during times of global uncertainty and during a pandemic, it can be easy to think, I may not be able to reach out for help right now. Is the help even available? And here at Avenue 360, one of the things I love about this agency is that we take a holistic health approach, which means that we have resources available for anything you might be experiencing affecting your health, including your substance use. We also meet you right where you're at as a participant. So, you know, we understand that it can be uncomfortable to talk about your substance use, and you may not even be ready to make a goal, but just the willingness to talk to someone who can understand, can offer you guidance and feedback can be really beneficial, and that is available. So don't wait, just like I think Cynthia and Ebony mentioned that, don't wait. The resources are available to you, and you can initiate your process of change. So if you're not familiar with what recovery is, my title is the Recovery Support Counselor. Here's our definition. Recovery is a process of change through which individuals improve their health and wellness, lead a self-directed life, and strive to reach their full potential. So that is what we do with our participants. And that may involve changing your substance use. We work with folks on substance use reduction, as well as safety planning. So, and we also, you know, have resources available as you move through that process of change. If you have a desire to live a life free of any alcohol and drug use, we have a virtual outpatient treatment program. The best evidence-based therapy for substance use disorder is group therapy. We need that connection with other individuals going through and walking through the same process of change as we are. And so I facilitate the virtual intensive outpatient treatment program. We have been able to move our groups into a telehealth virtual environment, and we've been abundantly successful. You know, the participants that I work with still feeling that connection, still feeling that support, and they're receiving recovery coaching support, counseling support, and support from their peers. We have a recovery coach who is fantastic that can help you as a peer walk right alongside everything that you're experiencing in your recovery. So if you'd like to talk about your substance use, if you have a goal in mind, or if you'd like to talk about formulating a goal, please reach out to us. There is no better time than now in this time of global change to start your process of change.
Thank you. My next question goes to Ebony. Texas ranks last nationally for access to mental health care. Why do you think this continues to be a challenge?
So according to Mental Health America's 2020 overall rankings, with the consideration of prevalence of mental health and access to care, Texas is 38th overall, but it has the third highest prevalence of mental health and in the country, and it ranks 51st when it comes to access to mental health care. This unsettling statistic can be attributed to several things. It could be no insurance or limited coverage of services. It could be shortfalls in psychiatrists and overall undersized mental health workforce. It could be a lack of available treatment types, for instance, inpatient treatment, individual therapy, and intensive community services. A disconnect between primary care systems and behavioral health systems for appropriate referrals. Here at Avenue 360, we have an integrated care model that mitigates some of that. It could be insufficient finances to cover costs, including co-pays, coverage treatment types, and when providers don't take certain insurances. Unfortunately, Texas has the largest uninsured population in the country, and it's also one of the states that has chosen not to expand Medicaid. which translates into 700,000 Texans not being able to afford consistent treatment or care for mental health issues. In turn, making jails and emergency rooms the primary contact for people with mental health issues. In 2013, Texas made some strides towards addressing frequent flyers with an increase in funding. However, we still fall short overall. Per capita, Texas spends 34% less than the national average on mental health services at $38.99 per person. We have to do better, but we're working on it. Mayor Sylvester Turner and the Houston Health Equity Response Task Force hosted a virtual town hall that focused on mental health, healing, and wellness in our community. And just yesterday, Mayor Sylvester Turner and the City of Houston announced launching a new mental health program funded by the CARES Act, providing 24-hour hotlines, virtual support groups, and other resources to help people during the COVID-19 pandemic. Here we're available also at Avenue 360 in an integrated care model, one-stop shop.
Thank you. Cynthia, when should a person seek for mental health support or counseling? And what options does Avenue 360 have for those that are underinsured or uninsured?
At Avenue 360, we don't turn people away if they're in need of services. And I think that's something very important because mental health is very important. And so also one of the things that we have now is that we have people, because I think it was as Sandra said, they are trying to stay safe during the pandemic. They may not have transportation other than the bus and don't want to be getting on the bus because of contact with people. So now we're able to offer, in addition to our face-to-face sessions, we can also have sessions with patients either via Zoom or by telephone. And some people do feel more comfortable with that right now. So that means that they can go ahead and reach out for the help that they need, and they don't have to worry about putting themselves in a difficult position. And we're happy to do that with people.
Thank you. So this actually concludes our discussion. I want to thank you for joining us today. If you have any questions about our behavioral health services, please call 713-426-0027. Thank you.
Thank you.
Thank you.
Thank you.